Hi, my name is Dr. Edmund Chow. My preferred pronouns are he and him. I have short cropped dark hair and am wearing a blue long sleeved shirt. I'm presenting from my classroom at LaSalle College of the Arts in Singapore. The title of my topic today is Radio Pedagogy and Homeschooling, a proposal for women's empowerment in Afghanistan. All right. Before I begin, I would like to give you some background about my applied theatre work because this usually raises questions on positionality and ethics. At the end of 2012, I was working for an NGO in Kabul, Afghanistan. And in this photo, the women's faces have been blurred out to protect their privacy. As their project manager, I oversaw the running of a US embassy-funded project for women's empowerment and entrepreneurship. We produced 37 episodes of a radio drama called Da Dostoy Roshani, which means In Search of Light. We recorded in Farsi and Pashto, the two major languages in Afghanistan. In this photo, one of my actors and I were anxiously listening to the callers who called into the radio station right after the broadcast of our first episode in March 2013. So that was my first project with an Afghan NGO. In 2016, I graduated with a PhD from the University of Manchester, where my research examined the representations of Afghan identities in the culture industry, specifically from theatre inside and outside Afghanistan. Now, this was a 4 to 5 year research project that allowed me to understand and analyze the complex dynamics of international relations and the consumption of victimhood discourses in many of these theatre productions. Since 2016, I have intermittent involvement with Afghanistan. As an applied theatre practitioner and educator, I thought it would be important to maintain connections with Afghan communities so that it would be a more reciprocal relationship even without official research grants or funding from universities. Last year, I was invited to be part of the Kandahar Women Peace Unity Association to help them write proposals to secure funding. And in the NGO world, a request for proposals, or RFP, is sent out by donors such as the US Embassy, the World Bank, or UN organizations such as UNICEF or UN Development Fund. In these RFPs, there are specific criteria to meet. When they receive proposals from civil society organizations, they would decide which proposal wins the bid and are therefore allowed to implement what they had suggested. Now, this presentation is a shortened version of our proposal, namely focusing on the programming. We did not win the bid eventually, probably because our budget was higher than the winning proposal. But I thought it would be a good example to share with practitioners who are involved in applied work to see how creative disruption is needed to design programs for various communities and to have a larger conversation or raise a question about sustainable impact in conflict zones. RFP criteria. The request for proposals came from UN Women's Peace and Humanitarian Fund in partnership with Spotlight Initiative. The proposal must be aligned to the two outcomes listed here. Spotlight Initiative outcome number 6 says women's rights groups, autonomous social movements, and relevant civil society organizations, including those representing youth and groups facing intersecting forms of discrimination or marginalization, more effectively influence and advance progress on gender equality and women empowerment, and ending violence against women, including sexual and gender-based violence and harmful practices. And Women's Peace and Humanitarian Fund outcome number 5, which states ensuring that women and girls' safety, physical and mental health and security are assured and the human rights is respected, requires measures that prevent acts of violence, facilitate access to services for survivors of violence, and strengthens accountability mechanisms. It was an open RFP But they did mention that projects can be designed to directly respond to the COVID-19 pandemic as long as they're aligned with these two outcomes. The funding stream for the proposed program could be from USD 30,000 to USD $200,000. In other words, to secure funding, our proposed programming should meet at least these three criteria: to promote and advance women's empowerment, to end gender-based violence, and to address COVID. Context. Now, to understand the context, we decided to look at the spread of COVID in Afghanistan in October 2020. And according to the Strategic Situation Report published by UNOCHA and the World Health Organization on 28 October 2020, the Ministry of Public Health data shows that 41,032 people across 34 provinces in Afghanistan have been confirmed to have COVID-19. 34,217 people have recovered and 1,523 have died, 76 of whom were healthcare workers. Now, however, due to the absence of a national death register, confirmed cases of and death from COVID-19 are likely to be underreported, with an overrepresentation of men in testing. Oxfam, in their report, A New Scourge to Afghan Women, COVID-19, briefing note, reported that access to an already weakened healthcare system had disproportionately affected women. Citing humanitarian response and World Bank statistics, only 15% of nurses and 2% of medical doctors in Afghanistan are women, leading to massive shortages in female healthcare staff. On top of that, women have to be accompanied by male members of their family when they leave their house. This dependency becomes an additional burden, especially exacerbated by the fact that women and girls are caregivers in the Afghan household. This either means unlikely chances for medical treatment and/or increased risk of transmission due to gender roles. Now, we should also not ignore that access to menstrual hygiene, obstetric, reproductive, and other primary healthcare products and services would also be severely hampered. Another independent Oxfam COVID-19 multi-sector needs assessment in 20 districts of about 607 households in Herat, Daikundi, Bamiyan, Kunduz, and Nangarhar provinces found that 97% of their female respondents had said that gender-based violence has increased since the pandemic began. One provincial coordinator of a CSO mentioned more cases of suicide in Herat, whilst a CSO organizer from CSO from Balk explained that the men being at home full-time have become more sensitive to women's behavior, hence resulting in partner violence. With a ban on social gatherings, it means women are not able to have their conflicts resolved in the traditional informed conflict resolution mechanism called Loya Jirga, as seen in the picture here. As such, disputes are not resolved and domestic tensions continue to rise. And in our ground understanding with our NGO in Kandahar, they said that the beating and torture of women, elderly, and children are underreported in regional protection reports released by UN agencies and the Global Protection Cluster. Because there is no safe house for battered women, they are generally kept away at the police headquarters for a while before being handed back to their families, further exacerbating the violence. Another context we needed to consider was the intense migration of people. Since 11 October 2020, there is fighting between the Afghan National Security Forces and the non-state armed group, causing a displacement of 11,633 civilians in Helmand and thousands more in Kandahar and Uruzgan provinces. So what can we do? We proposed developing an interactive radio drama to not only teach children academic subjects, but also strategies to address violence in the home environment. In terms of the curriculum, the weekly drama broadcast on radio is structured as problem-based learning, where both callers, radio listeners, and children will be taught critical thinking skills and practical knowledge to solve a problem the characters face. A rather simplistic example I can think of right now could be that the main character has just witnessed domestic violence at home. The drama would allow the listeners to choose a few options such as A, report it to the police, B, run to the nearest safe house, C, fight back, D, do nothing. The consequences of each action would have further implications on the safety of the character. But this also requires the listener to not only weigh the advantages and disadvantages of their options, hence critical thinking is involved, or literacy skills in writing a report, or mathematical skills could be incorporated to measure the time and distance to the safe house, as well as to calculate the probability of being hit in retaliation. Now, this kind of problem-based radio drama is our proposed cluster homeschool program. Why radio? This is important because, as I have raised earlier, there are too many people who are displaced by intense fighting in the southern parts of Afghanistan. Since they are on the move, electricity and mobile networks could be disrupted. As such, a transistor radio will be the next best source of information and education for people on the go. It is also relatively cheap and light to carry. It is also very unlikely that books will be brought along with these displaced families. So curriculum can only come from a curated drama program broadcast on radio. That's how we use the term radio pedagogy. Secondly, radio dramas are very popular in Afghanistan. The most popular soap drama, New Home, New Life, which has been funded by BBC, is still being aired since 1994. It has provided generations of Afghans a source of entertainment. So our radio pedagogy seeks something similar with a target listenership of women and children. And apart from that, we also know from literature review that radio has been successfully used for humanitarian and peace-building purposes in countries such as the Philippines, Indonesia, Pakistan, India, Nepal, the Democratic Republic of Congo, as well as West Africa, including Sierra Leone and Liberia. Now, why homeschooling? With the increased restriction of girls and women in some families, attendance in regular schools is still largely for boys. But with these displaced families on the move, going to schools would not be their priority. Hence, a homeschooling model is proposed. Our cluster homeschool program objectives are twofold. One, to involve women's participation into decision-making and leadership roles within their household and communities. And two, to provide psychosocial support and services through an educational program. Now, because this is an RFP, we therefore seek to align our objectives to those of the donors, largely in these areas. End violence against women, advance women's empowerment, ensure psychosocial safety of women, strengthened accountability of mechanisms. And to make sure some of these are more measurable, we made further alignment with UNICEF Inspire's objectives in the following 4 ways. 1, to form norms and values to support non-violent, respectful, nurturing, and gender-equitable relationships for children and adolescents. 2, to strengthen positive parenting practices and create more nurturing parent-child relationships. 3, to strengthen the quality and coverage of reporting mechanisms, response services, and prevention of violence against children in all sectors. And 4, to increase school attendance and achievement, postpone child marriage and early childbearing, and to build more gender-equitable, non-violent relationships. How does it work in reality? Our cluster homeschool program has 3 phases. Phase 1 is the recruitment phase. Now, phase one is essentially about capacity building. We want to engage women to undergo teacher training in areas of pedagogy, curriculum, and creative delivery across different disciplines and across age levels. Now, let's imagine recruiting a core group of 10 master trainers who will then be mobilized into their own communities to each train 10 women to be teachers that will produce 100 homeschool teachers. These 100 homeschool teachers will go into family clusters according to districts to educate children from basic numeracy and literacy to more complex approaches in science and critical thinking. Now, the core group of 10 master trainers will do follow-ups, supervising and monitoring their networks of teachers. After one successful cycle over a few months, they can continue to recruit and train 10 more, and the cycle goes on and on. Now, this not only ensures accountability and some form of academic standards, but it is also a more manageable system of mobilizing the community to participate in their own capacity building and education. Our recruitment strategy firstly offers free education as a social leveler to these adults. Secondly, to the core trainers who will be paid basic salaries, it is an entrepreneurial model that not only professionalizes the reputation of teachers, but also allows them to make a living as educational trainers. As the picture shows, there is a multiplier effect. This, I argue, is a dynamic form of community-engaged leadership. That to train the children, we should be training the teachers and parents first, who would then autonomously empower other mothers to not only be educated, but to participate in the education of their own children. Phase two is the curriculum of our radio pedagogy. Now, similar to soap operas, we will first write stories of Afghan characters from a family which will hopefully resonate with regular Afghans. We will then review each episode and make sure it stops with a cliffhanger to make it interactive and educational. As highlighted earlier, callers would call in to suggest what the character should do next. This is where experiential learning and critical thinking comes in to broadcast messages of hope, to facilitate discussions with a radio DJ who is also a trained pedagogue, and to build emotional and mental resilience while conversing with radio listeners. These stories become a safe container for the feelings to be explored because it is twice removed from reality as it is about the characters' feelings. After the broadcast, the homeschool teachers recruited in phase one will gather in households to teach subject-specific curriculum in, say, numeracy and literacy from the episodes in the radio drama. That means the drama will have specific learning outcomes in different subject areas. Guided questions or worksheets will be provided by their master trainers. Phase three is the broadcast and homeschooling phase. The intended audience will be female radio listeners who may not be part of the cluster homeschool program, but will still benefit from the interactive radio pedagogy. And the other group will be children under the cluster homeschool program. In summary, we aim to use our radio pedagogy to professionalize and pay women to be trainers, and then to use this pedagogy to entertain and educate a wide network of women and children, formally through a structured homeschool program and informally through an interactive radio drama. Next, evaluation. As with all community projects, there is a monitoring and evaluation phase to measure if our expected outcomes have been achieved. However, due to the limitations of time and space, I will just list a few ways we came up with to do our M&E, monitoring and evaluation. To promote women's civic participation, to cultivate gender-equitable relationships in family and cluster networks, as well as to increase access to education and prevention of violence against children and women. Our data collection methods would include field observations, individual and focus group interviews, questionnaires such as the World Health Organization MICS Child Discipline Questionnaire and the Violence Against Children Survey. as well as journal writings and drawings by homeschooled children, call-in responses by live radio listeners, radio polls, and statistics from the radio station. 5, sustainability. Finally, as an exit strategy and to ensure some form of sustainable practice, we intend to scale up through replication and expanding geographical coverage. Now, as mentioned earlier, the 10 core trainers will train 10 other homeschool cluster teachers. After a few months, the 10 will train another 10. This cycle is replicated because these teachers are being paid. But beyond the financial incentives, the mechanism behind this replication is really self-motivation, self-esteem, and personal influence. The next strategy to scale up is to expand geographic coverage. Now, this will naturally happen because there are thousands of families on the move because of an ongoing conflict in certain provinces. We will start in Kandahar first. And as families move across provinces, new master trainers are recruited and the multiplier effect will start to snowball wherever they go. Ideally, this model of training and recruitment will continue since homeschooling via radio is accessible and safe. We are confident that this cluster homeschool program and radio pedagogy would yield tangible results to not only reduce gender-based violence, but to also increase empathy, kindness, a sense of community, and personal agency. Now, we will find new donors to sustain this project so that the good work that we envision lays the foundation for years to come for a peaceful Afghanistan. That's all for my presentation. And if you do have any questions, you can email me or we can continue this conversation in this conference. Thank you very much.